Hi guys, I just wanted to pop on here really quick to talk about build-up denials. I don't know about you, but the past few years in our offices and a lot of the offices I work with, build-up denials are just becoming more and more prevalent. Now, insurance companies are doing this, of course, because there has been more fraudulent claims sent out asking for payment for buildups when it really wasn't done by the office. So that's why it's been happening more and more. But I wanted to give you some tips to help you hopefully not get this claim denied and to get your buildups paid if it does come back denied. So my notes are down here. If I look and glance over here, I want to make sure I don't miss anything. So my first tip, intraoral photos. Make sure you're taking photos before you start that crown prep, sometimes even during, and then even after. I like to do it to even just show the patient a before and after photo. It's really great for marketing reasons too. So get those intraoral photos though before a crown, especially if you know that tooth is going to be a buildup, because once you start prepping that tooth, you can no longer get that before photo, and some insurance companies require that. So get a before picture if you can. Same with making sure that you have that PA and bite wing for that tooth. Another thing I ran into is some insurance companies require you to get an x-ray after you have performed the buildup and crown. So you might even have to get a post-op x-ray. So make sure you're getting the x-rays that you need. A lot of the times I'll have the dental assistants be in charge of this, and they just make sure, if they're doing a crown prep that day, they kind of have a checklist. Hey, do I have my intraoral photos for this tooth? We have our PAs? Do we have our bite wings? And then making sure, hey, am I stopping the doctor to get that photo in the middle of our prep for the insurance companies in case this comes back denied? A lot of the times doctors, they're in their zone, especially if they've been doing this the same way for 20, 30 years. They might not be used to stopping in the middle of a procedure to take a photo. This is where the dental assistants can be a huge asset just to get every documentation that we need for insurance companies. And then make sure that your clinical notes, that they're going to match your narrative. So narratives are so important when it comes to getting paid for buildups. You're going to want to make sure to note, how many millimeters was removed. Note any recurrent decay that was removed. List any missing cusps, especially for buildups, and how much of the tooth structure was remaining. Some insurance companies, 50 or 60% of the tooth structure has to be removed for a buildup to be covered. So you want to make sure that is in your clinical notes. And then taking those clinical notes to your narrative. And just so you know, any narrative that you send to insurance companies, that has to be in the clinical notes as well. And then if a buildup gets denied by an insurance company, so first, I want you to be looking at that EOB, because if you are in network with that insurance company, sometimes they will not even allow you to charge the patient for the buildup. So they may not cover it and tell you that you can't charge the patient for the work that you did. So especially in these cases, I would appeal it no matter what the situation. Especially in these cases, we need to appeal that denial. Some companies, it might be in their clause that they consider buildups a part of the crown preparation, and they might not cover buildups at all, no matter what, under their plan. If that's the case, I suggest that you make sure this is accurate by having the patient request from their HR department their plan document, basically the insurance contract, so that you can verify that the language in the contract does state that a crown buildup is part of that crown preparation. Sometimes insurance companies might just use this, but it's really not a part of their plan contract. So make sure that it's in there, that they're not going to cover a buildup no matter what. Now, if it is denied because, and they might state that you can't charge the patient, or it's just denied, you're out of network, and they're saying this is patient portion. The first thing I would do when I get a denial from an insurance company for a buildup is I will call with that claim number, document number, and I am going to give them the seat date. A lot of the times, insurance companies, they just need to make sure that crown was seated. So if you call and give them the seat date of the crown, sometimes that's all they need to then pay the claim. If you perform same day crowns, if you have a CEREC machine in your office, make sure you're noting that on the narrative when you send it in, that you do same day CEREC crowns, so that they know the seat date is the same as the prep date, and your buildups won't get denied as frequently. So I hope that this was helpful. If anytime your buildups are denied, I do recommend appeal. First call, give them the seat date. If that still doesn't work, appeal it. Ask for that peer-to-peer review. A lot of the times that trick will get it sometimes just covered. But keep going until they come back and pay it, because the squeaky wheel gets the grease. So if this insurance company knows that you're just not going to roll over when they deny your buildups, the likelihood of them coming back and denying it over and over will lessen. So appeal it when they deny your buildups. And I hope these tips are helpful. And if you have any other questions about getting your buildups paid, please just shoot me a message. You can comment here. You can direct message me or email me, Ashley@bonddentalconsulting.com. Have a great rest of your day, guys. Bye.